Well, the Commission for Gender Equality says government's response to gender-based violence lacks accountability. The Commission has released its report on the Government Emergency Response Action Plan on GBV and femicide. President Cyril Ramaphosa unveiled the plan in 2019 and allocated 1.6 billion rand to its implementation. But the Commission says it was hastily implemented and lacks effective oversight. Well, let's chat more about what they found and what they're recommending now with the Commission's Dr. Nthabiseng. Dr. Moleko, very good morning, and thanks so much for your time. So you've identified that whatever was put in place was just not being effective. There have been no fruitful results yielded from these. What is it that you found needs to happen? Where are the areas that we're missing, and what needs to be done?
A very good morning to you and your listeners. Thank you so much for having us. I think the first thing is to just give an overview of the 5 areas that the Emergency Response Action Plan was supposed to cover. So what the Commission has done is to do a review of each of those targets, and you would find that there are 80 targets which we assessed using an auditing approach, looking at the performance and information across the state agencies, across the various implementing agencies. So it's very important for us to show what we found was that of the 80 targets, 17 of the 80 have been achieved. That equates to 21%. The remaining targets, 12 were partially achieved, and only the bulk or the majority, 51 out of the 80, which is about 64%, were not achieved. And this for us was done scientifically, looking at the performance, looking at audited information, which we used in a methodological assessment to look at each of the interventions that the government had promised the nation on. The 64% is then split up. Your question would be, where did we find problems? I think primarily access to justice for victims and survivors. We break it down in the report and give an analysis. For an example, I'll start with that one on the access of justice. There were clear problems with the backlog in terms of DNA samples, forensic laboratories, and commitments made in terms of making sure that we finalize backlog of cases. We found that only 8% of cases were finalized. Another example is the setting up of a forensic lab in the Eastern Cape. The procurement process started with a bid spec, and you must remember there is a time frame for the application of the ERAP emergency response. And so we found that within that 6-month period where it was supposed to be set up and established, this was not the case. We can go to the family violence, child abuse and sexual offences units. We did find a partial implementation of the HR plan of making sure that some of the personnel biceps are boosted to enter into the FCS, what is known as the FCS, if I summarize it. But you found that across the board, some of these access to justice indicators and the performance thereof was really lackluster. I think that this was concerning for us, and particularly on the inventory log, the cases that are outstanding and the backlog of cases that were prioritized. We found that there were some of the issues that were partially achieved. And this is where we were assessing to say, how do we improve the access to justice for victims?
Well, Dr. Moleko, so how do we do that? How do we do that? Which are the institutions, which are the bodies, the organizations that actually need to come to the party that have not been playing their part now?
Well, let's look at the issue of monitoring and evaluation. The effectiveness of promises is in the oversight, is in strengthening accountability whereby there's non-implementation. So for an example, when we look at the backlog of cases, there should be, number one, the performance assessments of those responsible, they should be held liable and responsible. Secondly, we've got to make sure that those cases that are in the system, the NPA, there are targets that are put in to strengthen the processes to make sure from an HR perspective, institutional capacity is improved. We found that that has got to be assessed and also implemented very much so if we are going to see a change in the rollout of these programs. So I think that from an institutional perspective, we've got to hold our institutions to account. They've got to be heads that roll. Those that didn't implement what was supposed to be done, they've got to be held liable and accountable, because the numbers are there, the targets are there, but we're seeing that from a backlog, from improving the effectiveness of these support mechanisms, we are not seeing the numbers. So we've got to hold ourselves to account and make sure that those that are responsible institutionally are asked, and we are going to do this as the Commission for Gender Equality. All the stakeholders, there are about 22 departments that are will we assess through this report, and we are going to call them to say, what therefore will you do as a result? So I think to answer you, what can be done? CGE has powers. CGE Act enables us as a commission to not only call departments out, but to call them to hold them to account and not just monitor and evaluate, but to ensure that from an ongoing perspective, they implement the recommendations that are made in these reports.
And Dr. Moleko, I think absolutely that South Africans are tired of this. We are scared, we are anxious, we are fearful as well, that the time has come now for proper action. And I'm glad to hear the passion in your voice as well. And I just hope that that is going to translate into action finally. I mean, it's not just about the institutions you talk about where something has happened, the worst has happened to a woman or a child, and they're trying to seek help. We need to get to the point where nothing is happening to them, that they're actually being protected and not hurt. And I'm hoping that what your plan is going to go a long way to prevention and deterrence as well.
Absolutely. I think that the fundamental issue here is once you've done a review and an evaluation of an implementation plan, fortunately, there are key targets that have been identified. We have found that only 12 out of the, only 17 out of the 80, 21% have been achieved. 51 out of the 80, 64% have not been achieved. What this means then is that we have recommended the government must take to account all of the different departments and the different stakeholders that are responsible for the implementation of the ERA. 2, there's got to be overview, the Gender-Based Violence Council, the GBVF Council, which is an institutional structure that should oversee some of these key targets, should be fast-tracked. There are various targets that have not been implemented by key departments, which we have outlined here. We are saying CGE is going to call each and every one of those. We are taking the responsibility as a watchdog and saying we are calling each and every one. The report has gone public now, but it's not enough for us to simply launch a report. What is important for us is to follow through on the interventions, and we have put in our plan for this year critical follow-through monitoring of those institutions, making sure that all of our institutions from a provincial level to the national institutional level oversee the execution of the monitoring of the 5 targets. I want to stress one of the targets, the economic empowerment, which was committed by the state to say we are going to make sure that from an economic perspective, land reform program, 2,000 young people were supposed to be given land. The reorientation of our budgets, i.e. you monitor the 40% procurement, right? Making sure that all women who enter into shelters are given economic linkages so that they can exit domestic violence relationships and they are not economically reliant. We have found many of these targets, there's very poor performance and not enough showing us that the targets were met and there's sufficient action by the role players. In fact, what we have seen is goal shifting where the very department is saying they are not the ones responsible. Therefore, we are going to find who is responsible and make sure that we hold them to account and action is taken.
All right, I'm excited by that, and I'm hoping that in a couple of months, Dr. Moleko, we'll be having a very, very different conversation. We'll be talking about improvement. We'll be talking about seeing all of this go into action. Still on the way.